So I just had an appointment with a psychologist who specializes in chronic pain and functional movement disorders. And I wanted to document my journey with FND treatment at the Cleveland Clinic. So I'm gonna talk about it. In another video, I'll talk about the physical and occupational therapy that I've been starting on. This video will focus on the therapy side because I was very curious about that, and I bet other people are curious as well. CBT has been studied and shown to be helpful for some people with FND. There are a lot of thoughts to be had about CBT for certain people. CBT can be very gaslighty for people who are dealing with systemic problems and issues, but it is helpful if you're dealing with like irrational thoughts. However, I don't feel like I'm dealing with irrational thoughts around my FND. I think everything I'm thinking about around all of my chronic illnesses is just like valid frustration with my life being interrupted by health issues. So in the past, when I've been recommended CBT, I'm like, well, I'm already in therapy. How is CBT for FND going to be any different? But at my appointment today, basically, like, I described how my symptoms affect me and what my days look like. And the psychologist I was talking to was like, hey, your body and mind don't have any middle ground when it comes to fight or flight and stimulation and activation and all that. And I was like, what do you mean? She explained basically that either I'm out and about in the community getting exhausted, being overstimulated, and my brain is like going at 100 miles an hour, or I'm at home taking a nap, asleep with an eye mask on, with no stimulation at all. So it's like I need that level of like extreme rest in order to recover from extreme stimulation, and there's no middle ground for me. And so what we're going to be working on is really just finding ways to find rest throughout the day so that it doesn't interrupt me the way that it interrupts me now. So that way I can find a way to like calm my nervous system down throughout the day, and not just by going home and taking a nap, which is what I do now. And it interrupts my day in a really big way. So how are we doing that? Basically, a few different ways. One, taking breaks throughout my day to do visual meditation. And that's specifically visual meditation and not guided meditation, because I hate guided meditation. And she was like, rad, here's another option. So that was cool. Two, taking mindfulness breaks. And we talked a lot about like walking mindfulness. I forget the author that she named. I think his name was John something. But it basically is just like the rhythmic movement. And she was saying like, if you can't walk, if you're able to stand, then like rock while you're standing. I have to look more into it. I have to read something about it to see what might work for me. But in my other therapy, we were working on tapping, which I can do regardless of my ability to stand or walk or anything. So those two things I can do like for 2 minutes a few times a day, and it won't interrupt my day. And then their third thing was more mindfulness exercises that have to do with like chronic pain that I might do as a way to wind down at the end of the day. So she gave me a workbook to look up called Get Out of Your Mind and Into Your Life. So if any of you have experience with that workbook, please let me know. For now, she recommended a specific exercise called Passengers on the Bus. So if you have experience with that, please let me know in the comments. That's therapy for FND so far. It's really more about calming down your nervous system than anything else. It doesn't really have to do with like processing trauma or anything, which I'm glad for because I've already done that shit. She talked a lot about, like, honestly, I described the things that work for me now, and it's a lot of, like, stop doing stuff and just rest. And that means I have to give up a lot of life. It means that I have to limit my life, limit the things I do. And I mentioned that, like, you know, I talk to people my age, and they're just doing all of this stuff. It's, like, so different from my life which is just managing with illness. Like every doctor that I had talked to before this was like, well, you're reducing symptoms, that's great. And she was like, there's a way for you to live your life without symptoms if we manage them correctly. And that's what I've been trying to do for years. That's what I'm trying to do now. Except now the only reason I'm able to do it is because I can go home and take a 3-hour nap in the middle of the day and no one will be mad at me for doing that. And then I go home afterwards, after I work, and I rest all day. I am hopeful that everything in summation, getting the POTS addressed, getting like the hypermobility addressed, getting the joint pain addressed, doing physical therapy, regulating my nervous system. I know it's not a cure. I'm not hoping for a cure, but I am hoping for a life. I'm hoping for more of a life.